So, greetings, greetings, Mendocino County. I am Dr. Doohan, your public health officer. And here I have with me George Verostegui, who is going to be making this presentation to our Latinx community today.
Ok, hoy día la doctora Doohan se dirige a la comunidad hispana para poder hacer una presentación de todo lo que estamos haciendo en la lucha contra la pandemia. Yo voy a hacer la presentación por ella. Si yo tengo alguna duda, voy a regresar con ella para que ella me aclare. Y vamos a tratar de hacer una especie de conversación para poder aclarar diferentes puntos que están aconteciendo en el condado. Next. Ok, al día de hoy nosotros tenemos 234 casos registrados. De los 234, 132 son hispanos, que hace un 56% del total de los casos en el condado. 120 se han recuperado, de los 120, 67 son hispanos y esto hace un 56%. En aislamiento tenemos 105 personas que constituyen el 64% del total de aislados. Tenemos 5 hospitalizados, de los 5 son 2 hispanos que hacen un total de 40%. En la unidad de cuidados intensivos solo tenemos 1 y único persona es hispano. Al momento tenemos 4 fallecidos, de los cuales 1 es de origen hispano, que constituye el 25% de los fallecidos. En aislamiento o cuarentena tenemos 29, de los cuales 7 son hispanos. Next. Bueno, nosotros estamos haciendo una serie de pruebas a lo largo de todo el condado para poder tratar de identificar tempranamente los nuevos casos. En este caso, las pruebas que se están haciendo le llaman de vigilancia epidemiológica, 19. These are positive, correct? 19 are positive?
These are
the numbers.
These are testing events.
Okay. Estos son los números de pruebas que se han estado haciendo o diferentes momentos a lo largo del condado. Son 19 eventos que se han llevado a cabo a lo largo de todo el condado. De estos, de prueba de vigilancia son 137 que hemos estado llevando a cabo y se aseguró que tengamos una identificación. O sea, la idea es comprometer a las clínicas de la costa para que ellos también puedan ayudarnos en realizar las pruebas. Igualmente estamos nosotros contando con llamadas que se hacen de manera semanal a nuestras clínicas locales y tratamos de abastecer a estas llamadas. En el local de la feria está ahí una compañía que se llama Surf, que está ellos también colaborando con la realización de pruebas de detección del COVID. Y estamos tratando de establecer un canal adecuado para que todas aquellas personas que necesitan hacerse las pruebas puedan acudir a este lugar en la feria que está llevado a cabo por Surf. Se ha celebrado un acuerdo para proporcionar nuevas pruebas a través de las clínicas locales. Y también nos hemos asociado con otros laboratorios de salud pública para poder hacer el procesamiento de pruebas de laboratorio.
And George, may I say that these testing have been free, no cost to receive this testing.
Ok, un aspecto importante de esto es que todas estas pruebas que se están haciendo en diferentes momentos, en diferentes lugares del condado, son completamente gratis. No cuestan un solo centavo poder acudir allí y hacerse la prueba. ¿Ok? Hay que tener en cuenta eso en todo momento. Next. Ok. Se han llevado a cabo una serie de iniciativas porque para nosotros es importante poder llegar a la comunidad hispana. Se está, en la página web del condado se está colocando la información en una especie de recuadro con todos los datos estadísticos de cómo estamos llevando las pruebas, el número de positivos, el número de gente que está hospitalizada, etcétera, para poder nosotros informar oportunamente a la comunidad hispana y en idioma español. Igualmente, se está proporcionando un segmento especial para poder informar a la comunidad en el idioma español sobre todos los cambios y las modificaciones y las nuevas órdenes que están aconteciendo aquí en el condado. Igualmente, la radio local, el KCYX o KZYX, igualmente ellos también tienen un programa en español para poder comunicarse en el idioma español a la comunidad hispana y estemos al tanto de lo que está pasando en nuestro condado. También estamos traduciendo algunos materiales educativos, algunos volantes o materiales para que nosotros podemos tener información a la mano y poder seguir estas directivas y cuidarnos del COVID. Igualmente también estamos participando en entrevistas con medios de comunicación, en este caso Periódico Al Punto está jugando un rol importante, la radio local KZYX, igualmente también ellos están haciendo entrevistas en el idioma español para poder garantizar que la comunidad hispana tenga información de primera mano. Se está haciendo un seguimiento de contactos y de a todos los casos positivos y también se ha hecho una nota de prensa para que la gente sepa que si resultan positivos a la prueba del COVID-19, ellos van a esperar una llamada del condado de Mendocino informándoles o que han sido resultados positivos o que han sido contactos con alguien que ha resultado positivo. Eso también se hizo semanas atrás. Estamos nosotros en vías de colocar una página web exclusiva dedicada para informar sobre recursos que tenemos del COVID-19 solamente en español. Estamos trabajando en ello y esperemos en los próximos días tener ya esto terminado. A partir del día de hoy va a haber un segmento exclusivo en español para poder, liderado por la doctora Doohan, para poder informar a la comunidad hispana exclusivamente de todos los avances, de todos los cambios en el idioma de nosotros. Asimismo, estamos usando la asistencia adicional para mejorar el tiempo de respuesta de las órdenes y proporcionar todos los comunicados a la prensa en español de manera oportuna. Y continuamos nosotros tratando es que estos materiales educativos también se puedan colocar en los medios locales y en las redes sociales en español. Vamos a desarrollar una pequeña nota de prensa en video y en audio para también en español para poder informar de mejor manera a la comunidad, y esto va a ser colocado en las redes sociales, en la radio local y de seguro en la página web del condado de Mendocino. Va a ser en inglés y en español. Y estamos tratando de coordinar con las diferentes organizaciones comunitarias para recibir ideas de ellos y de qué mejor manera podemos mejorar nuestro material educativo y de tal manera llegar a todos sin que exista la barrera del idioma y poder estar todos al tanto y cuidarnos de esta pandemia. Next. Ok. Igualmente, el condado está considerando, no sería contratar, pero contar con voluntarios para poder hacer seguimiento de casos en español. Ha sido un poco un reto bastante grande para nosotros con la capacidad de los trabajadores que somos poder abastecer el número de casos. En esto, por esa razón, se está pensando adquirir, contar con voluntarios para poder nosotros tener una mejor llegada a todos los casos y a todos los casos positivos y a los contactos de los casos en en la próxima semana. Igualmente estamos preparando mayor cantidad de boletines e infografías, material educativo para seguir manteniendo a la comunidad informada y educada. Igualmente también vamos a insistir en que es importante tener informada a la comunidad y educar a la comunidad para que no se llevan a cabo reuniones de ninguna naturaleza, porque se han identificado que estos han sido los principales focos de contagio y la manera como nuestra comunidad está siendo muy impactada a consecuencia de estas reuniones. Vamos a tratar, el condado va a tratar de contar con un intérprete a tiempo completo para poder en todo momento a disposición poder comunicarnos con la comunidad en español al momento que se le requiera. Estamos estableciendo lazos con diferentes organizaciones comunitarias de la comunidad hispana para que ellos también puedan involucrarse y poder hacer llegar estos mensajes de una mejor manera a cada rincón, a cada hogar, de tal manera de que podamos todos nosotros saltar al tanto y seguir las recomendaciones que se están dando a nivel del condado. Estamos tratando de montar un centro piloto en el centro de salud de Round Valleys, en Covelo, ¿correcto?
Yeah.
Ok, en Covelo, en el cual estamos tratando de poder allí hacer un seguimiento de contactos investigación de casos para poder ver si es que esto da resultado, podemos replicarlo a todo el condado, porque tenemos que contar con el apoyo de toda la comunidad para poder detener esta pandemia. Next. Este es un ejemplo de un volante, un tríptico, en el cual ustedes pueden ver allí que explicamos de manera detallada lo que es una burbuja, las características que tiene una burbuja social, decimos, qué actividades se pueden hacer, qué actividades no se pueden hacer, qué es lo que le considera para un grupo de trabajo, cómo usar adecuadamente un protector facial o un cubreboca, cómo usarlo de manera adecuada y siempre pensando en que nosotros podemos evitar que más gente termine en el hospital en circunstancias mucho más graves, como ya lo estamos viendo en nuestro condado en las últimas 2 semanas. Esto es importante. Y aquí también estamos nosotros recomendando evitar las 3C, ¿no? Evitar conglomeraciones o aglomeraciones, contacto cercano con otras personas y evitar espacios en los cuales haya muchas personas. Este es un tríptico que va a circular por todo el condado en el idioma español para que todos estemos al tanto y poder seguir estas instrucciones. Next.
So if we could pause on this, I'd like to look at the ¿Qué es una burbuja estable? A point I'd like to make is the top one, which is the household support units. We did have them as 12 and we shrunk them to 6 because of the increase in cases. The idea being that you need to limit the number of people that you're closely interacting with that without social distancing. And we know this is very difficult for people with large households, but to the extent that we can make groupings of 6, it's the more protective, if possible.
Ok, la doctora quiere hacer un énfasis a lo que es la burbuja social. Hace algunas semanas se estableció que una burbuja social estaba constituida por 12 personas, pero se ha reducido solo a 6 personas. Y esto porque el número de casos se está disparando de manera increíble. Entonces, a veces es un poco difícil que esta burbuja social de 6 personas se pueda cumplir en algunos hogares en donde el número que conforma este hogar es mayor de 6. Pero sin embargo, cuando se salga a la calle, cuando tengan alguna actividad fuera de casa, no debe superar al número de 6 personas esta burbuja social. Recordemos que una burbuja social es un grupo de 6 personas que han vivido bajo el mismo techo por 4 semanas. Es decir, si hay solo 5 personas y una persona se quiere integrar a esta burbuja, pero esta persona no ha convivido más de 4 semanas, no puede ser parte de esta burbuja porque tiene que respetar el criterio de haber convivido los 6 por 4 semanas bajo el mismo techo.
And Sarah, are we able to move our screen so that we can see the evite las tres Cs? Oh, not sure if we can.
Do you need to unmute?
Not in the PowerPoint, but we'll link them in the description. Also, we have a few questions coming in Spanish.
So these are posters. These are the posters, Sarah, that are available on our website.
Yes, and we'll link it down below.
Okay.
After the video.
Okay. Yeah. So the idea with the George, with the 3 C's, is that when we have open windows and open space where we're not crowded, it's much safer. So in this picture, you see the bubbles with COVID in them flying out the window instead of accumulating in the room. So the idea that the more we can do outside, the more we can do with our open windows, the more safe the environments are inside.
Ok. Igualmente vamos a detenernos un poco en esto de evitar las 3 C. Y si ustedes, si el público me sigue, al lado derecho de las Cs hay 2 personas que están con la ventana abierta. Entonces el virus puede salir por la ventana. Entonces no se queda en el ambiente cerrado y la posibilidad de contagiarse es mucho menor. Igualmente es preferible estar en un espacio abierto que en un espacio cerrado. Si nosotros vemos en el dibujo de abajo, estas 2 personas, y una está tosiendo o está estornudando y el virus se queda allí. Entonces la posibilidad de contagio en un espacio cerrado es mucho mayor. Nosotros evitamos mencionamos Cs, porque una C es por conglomeraciones o mucha gente en una sola habitación, contacto cercano con otra persona, o sea, menos de 6 pies de distancia, y espacios contenidos, es decir, una ventilación deficiente. Entonces, estas 3 C aplican en este caso. Ok, next. Ok, estos son algunos recursos adicionales que nosotros que podemos tener nosotros en el idioma español. Ustedes pueden dar un link en cada uno de ellos y ver qué recursos podemos nosotros contar y qué es lo que nosotros podemos necesitar para poder tener la asistencia del condado y ayudarnos a transitar por esta difícil situación.
We have 2 questions. One was if your family has 6 people, does that mean you can't have a bubble? Like you're just limited to your direct family and your household?
You would try to be, to the extent you can.
Yes. O sea, a la pregunta de que si una familia está constituida por 6 personas, esa familia ya constituye una burbuja social. Entonces, si en alguna eventualidad ellos salen a pasear o salen a algún lugar, entonces ellos tienen que estar juntos en todo momento sin que ningún extraño o familia que haya compartido el techo por 4 semanas pueda entrar a ello para evitar el contagio del virus o que entre ese virus a esa burbuja. También tenemos algunas noticias. La doctora Doohan va a hablar sobre una nueva ordenanza que ya entró en vigencia. Could you please, doctor, could you explain a little bit on the order?
Yes. So Because we now have 234 cases and 5 deaths in Mendocino County, and we're having on average 10 new cases every day, we are in a position to be on the state watch list.
Ok. En vista de que al momento tenemos 234 casos, 5 fallecidos, y más o menos en las últimas semanas, en los últimos días, estamos teniendo 10 casos por día, 10 casos nuevos por día. Entonces ahora nosotros ya estamos dentro de la lista de alto riesgo establecidos por el gobernador o por el gobierno local, el gobierno del estado de California.
And the new order of the governor is that counties that are on the watch list will need their schooling to be distance learning unless the school requests a waiver from the state.
Okay. Y en vista de que ya estaríamos dentro de estos condados, el condado estaría dentro de esta lista de alto riesgo, entonces la escuela, las escuelas van a tener que empezar sus actividades educativas de manera remota, o sea, es decir, con el uso del Internet, a menos que la escuela pida una excepción. This exception is directly to the state or to the county?
It's to the state.
To the state. Esta excepción, la escuela la puede someter directamente al estado de California y ellos decidirán si le permiten o no que las escuelas, que esta escuela pueda desarrollar clases en persona.
So the health officer is working with the schools to see which schools will want to request a waiver to have in-person learning, and we still don't know yet all of the information, but we should know more in the next several weeks about which schools will be distance learning only and which schools might have the opportunity to have some in-person learning.
Uh-huh. Y la doctora Doohan está coordinando con diferentes escuelas para saber cuál de ellas quiere aplicar a esta exoneración de estudiar, de manejar la escuela de manera remota. Y hasta el momento no se sabe, no hay ninguna escuela todavía, pero en las próximas semanas ya nos vamos a enterar qué escuela va a optar por hacer el trabajo educativo a distancia o lo va a hacer en persona. Ya en la próxima semana nos vamos a tener más información al respecto.
And today there are new orders on our website, which are translated in Spanish, coming into effect because of this data that is putting us in the position of the watch list, where certain high-risk sectors must have outdoor. They must move their businesses outdoors if they are to stay open.
Uh-huh. Ahora, esta nueva ordenanza que entra en vigencia el día de hoy, debido a que ya estamos considerados como un condado de alto riesgo, ordena que las diferentes actividades económicas, los diferentes comercios van a tener que mover sus actividades económicas fuera de ellos. Are we talking about restaurants? Are we talking about?
So this is across the state of California. For restaurants were already having to go to outdoor dining already across the entire state.
Uh-huh.
But this is for gymnasiums.
Okay.
Personal care like hair cutting, uh-huh, and places of worship.
Oh, okay. So las actividades que van a tener que salir a hacer sus actividades afuera del recinto de donde ellos están son los gimnasios, lugares donde se llevan a cabo actividades religiosas y actividades de alto riesgo, como por ejemplo los salones de belleza, o in this case are considered also tattoos.
Personal care businesses.
Oh, okay. So, for instance,
nails,
okay.
Facials.
Okay. Y cualquier actividad que se quiera hacer en la cara o en las uñas también van a tener que hacerse al aire libre.
And you'll find this on our website. There is a Spanish language new order with this information.
Y toda esta nueva ordenanza que entra en vigencia el día de hoy, ya está traducida al español y está ya en el condado de, en la página web del condado de Mendocino, en español.
And the final announcement is that we're very delighted to welcome Dr. Andy Corin, a family doctor who's bilingual in English and Spanish, will be coming to be the health officer towards the end of August. And I will work closely with Dr. Corin throughout this year to make sure that he has a very successful transition to being your new health officer.
Okay. Bueno, la doctora está anunciando que ya pronto vamos a tener un nuevo oficial de salud, es el doctor Andy Corin. Él probablemente entre en funciones a finales del mes de agosto y ella va a estar acompañándolo estas semanas hasta que él entre en funciones para poder, digamos, orientarlo en todo el trabajo que ella ha estado liderando y se continúe por la misma senda. El doctor Andy Corin es un doctor que es bilingüe y además él es un doctor de familia.
Gracias.
Okay, so that's it. Okay, any other questions? No? Okay.
Okay. Adiós.
Okay, thank you.
Mendocino County. This is Friday, July 24th, and we're here for a health officer update with Dr. Noemi Doohan, and then we'll have some brief words by CEO Carmel Angelo. And if we have time, we'll take some of your questions in the comments, so just leave them below, tag us so I can see them. And with that, I'll turn it over to Dr. Doohan.
So greetings, Mendocino County. I'm giving you the weekly health officer report today. Thank you for your time and connecting with us. As I've shared before, in this pandemic, we have three ways to battle the pandemic. We have containment, we have mitigation, which is controlling the spread, slowing the spread, and then we also have communications. So these weekly updates are so very important, and we thank you for your attention and your time, and also to say that we're making an increased effort and commitment to making sure that we're communicating with our Latinx, with our Spanish-speaking community. And so we just before coming on here had a Spanish language 30-minute presentation, and we had workshops on Tuesday, and then a lunch meeting earlier today, where we're really focusing on our Latinx community. So if you are a member of our Hispanic community, know that we care about you and that we are working even harder to do our duty to serve you. So one of the issues that we're facing now in Mendocino County is the need for data that is timely. We struggle with having data that is up to date every single day. There are several reasons for this. One of the reasons is that the testing that we're doing is taking about 2 weeks for us to get the results back. So right there, whatever I'm telling you about new cases today, this is as quickly as we're able to get the test results back. And therefore, we're really about 10 to 2 weeks behind when I tell you that we have 234 cases now. And we've been having about 10 new cases every single day. So this is a substantial change from what we've had even a month ago. A month ago, we would say maybe 1 new case a day, maybe 2. Now we're having 10. So this is what we see when we start to surge in a serious way. But as I'm telling you that we're having 10 new cases today, that is old data actually, because those were tests that were done perhaps 10 days ago. So this is a challenge for us. We are not getting testing with a fast enough turnaround time, and that's across the entire state of California. That's not just Mendocino County. So the data that we have as of today is 234 cases, about half of those in the last 2 weeks. We've had 5 deaths at this time. We've had 3 deaths associated with the Fort Bragg Sherwood Oaks skilled nursing facility. We had a death of a gentleman earlier this week at Howard Memorial Hospital, and we had our first death, which I had reported last week from the skilled nursing facility in Marin. So we've had 5 deaths. This is out of 234 cases, to have 5 deaths is about a 2% fatality rate. This is what we've seen across the state of California, that about 2%, so 2 out of every 100 die from COVID. This is very serious. So of our new cases in the last 10 days, we have 105 new cases that have been identified within 10 days that are in isolation. So isolation meaning that they need to stay home from 10 days from their test date. To be on the watch list for the state of California, we would need 100 new cases in 14 days. So in general, it's 100 new cases per 100,000 population in 2 weeks. That's where we're at now in Mendocino County. We are seeing, when we are on the front lines in the public health department, seeing the data as it comes in, seeing the case investigation and contact tracing as it comes through. We're seeing very concerning findings from that case investigation contact tracing. We're seeing, for example, individuals who, while they were sick, did go to work and in settings, and while they were infectious. We're seeing individuals while they were sick going to large gatherings. And this leads to complicated case investigations and contact tracings, of which we have a number going on around our county, which I'm not going to speak about in more detail now because they're still under investigation. And in some cases, they're being responded to by the healthcare facility where these individuals work. I mean, in all cases where they are related to a healthcare facility, they're being responded to by that healthcare facility. So it's very concerning that of our new cases, 105 new cases in isolation, 60% are from the Latinx community. And of the 234 cases that we've had, 56% are from the Latinx community. From our 5 deaths, 1 individual that has been identified as being from the Latinx community. So we're very, very concerned about the disproportionate representation of the Latinx population in our cases, and that's why we are doing more, even more than we have before, to respond to the needs in our Latinx community. Regarding testing across the state, There are shortages in the testing reagents, in the sample collection kits, and then we're seeing this extensive length of time to get results back. This is very challenging for us as we're responding to the surge that we're seeing in our county. We do have the ability to do outbreak testing in the state public health lab in Richmond, California. But again, we did outbreak testing for what we were seeing in Fort Bragg on Sunday, and we're having a slow response time in getting those results back. We had hoped we would be able to report back all of our results within 72 hours on that outbreak testing. I want to thank the Anderson Valley Clinic, and I want to thank MCC Mendocino Coast Clinic for participating in such rapid response to doing outbreak testing in both Anderson Valley and Fort Bragg. I had hoped I would be able to get those results back by Wednesday, and we are gathering those results today. So there's a delay in getting reports of testing back to us in every category, whether it's outbreak or whether it's surveillance testing. In order to use the Richmond lab testing facility moving forward, we would have to have 3 cases in one business. That would be defined as an outbreak, or 1 case in a congregate setting like a skilled nursing facility, a jail, homeless shelter. Regarding surveillance testing, this is something that we have been working diligently on with our clinical partners, such as I just mentioned, Mendocino Coast Clinic and also Anderson Valley Clinic, but the other clinics as well in our healthcare system. We're so grateful to them for partnering with us with surveillance testing, as well as with contact and case investigation, contact tracing. So with the surveillance testing, this is intended for people who are not sick, they have no symptoms, or people that also for people that have had no contact with a case. So surveillance testing is for people who do not believe they have any reason to think they have COVID. That's why it's called surveillance testing. However, we do have people coming to our surveillance testing sites, which are put on in some cases by our community clinic partnerships in partnership with public health, or they're put on at OptumServe, where we have our facility set up in Ukiah at the fairground. We do have people that do show up with symptoms of COVID, or they show up saying that they were a close contact of a case. In these cases now, I have orders that I released last week where that it is ordered that these individuals should be handed isolation or if they're sick, or quarantine orders if they're a close contact, so that they go home and they isolate or quarantine. So therefore, if an individual does come to a surveillance facility for testing and they're sick or they're a close contact, they will be ordered into isolation or quarantine. We do have some news that we do want to celebrate today, which is that through the advocacy of myself and our DOC at the level of the state, we were able to get an Abbott ID Now testing machine for the MCC Mendocino Coast Clinic in Fort Bragg. The reason why this clinic was chosen was, for one, they're a very, very strong clinical partner. They have certification set up, the CLIA certification set up to be a testing site, and they were ready. Lucretia Renteria was ready to accept this resource on rapid notice. And because I was given the opportunity rapidly, I did want to bring more resources for testing to the Fort Bragg and to the coast. So that Abbott machine hopefully will be arriving today, was what we expected, with 300 test kits. And this is for rapid testing for people that are symptomatic or have close contacts with cases. In other words, they have what we call a high pretest probability of being positive, or they're at high risk of being positive. So we're very, very grateful that the state has provided yet another resource for us in Mendocino County to keep our county safe. But as you've heard me talking now about the fact that we're surging, the fact that we are having on average of 10 new cases every day now, which puts us into the parameters to be on the state watch list. At the same time, our testing capacity is lagging behind what we need it to be. Therefore, we are imminently going to be placed on the governor's watch list. So we have been contacted today by the state. We have an emergency call planned at 6 p.m. We don't know when this will actually occur, that we would be put on the watch list, but we are expecting it to be any time. The reason we don't know when it will occur is there's a lag. Just as we in Mendocino County have a lag in our getting data reported from the laboratories about new cases, we have a lag with that data reaching the state. And I've been talking with the state about why that lag might occur, but regardless, we know this is coming, that we're going to be on the watch list. So what does that mean? It means something very significant for school reopening because last week the governor announced new orders, which he calls guidances, but they're orders, that any county that's on the watch list will need to have distance learning for their schools unless the schools go through a process of requesting a waiver from the public health officer, which then the public health officer elevates up to the state, and ultimately it's the state that looks at these requests to say whether a school could have in-person learning, even though that county is on the watch list. So I had a meeting earlier today with the schools. Thank you to Supervisors Dirty and Williams for convening this meeting about how we might elevate those requests on the part of certain schools that do want to consider having in-person learning despite this position that we're in the county of imminently being on the governor's watch list. So that waiver process does need to be requested by the superintendent or leader of the school with the community, with the labor, and with the unions, and with the parents. So this is not just something that, let's say, the superintendent would ask for, it's something that they would have to ask for with collaboration of those that are teachers in the schools, as well as the parents and the community at large. But I am here to stand by the schools. I never did close the schools, and I never will be more restrictive than the governor for the schools. So we're just following along with the governor in terms of what is going to be allowed. There are no orders coming in. There are new orders coming out in effect today. They actually came out last week, but they're coming into effect today. And that is to align with the state for watch list closures of businesses. So those counties that are on the watch list will be have been mandated by the governor to close high-risk businesses to indoor operations. This is on the county website. You can see these new orders again, which were released last week, but they come into effect tonight and midnight. And these are for gyms, places of worship, non-critical infrastructure offices, personal care, including hair salons, will need to have their operations outside, along exactly as any other watch list county across the state of California has been mandated to do by the governor. This movement to activities outside is in recognition of the data that is showing that enclosed spaces are much more contagious than outdoor spaces in terms of limiting the spread of COVID. So opening the windows, having activities outside with social distancing and wearing facial coverings is substantially more protective and safe than being inside. So to the extent that we can open windows and have activities outside, we should. And the reason why these particular businesses were picked for the watch list category was because they are activities where we bring people together from different groupings, and they tend to be together for a longer period of time, such as a gym. So I want to finish up by thanking Dr. Andy Corin, who I've worked with closely for years prior to my coming to the county. It was a year ago that I came to the county to be your health officer. Many of you weren't aware of me before COVID because the health officer generally doesn't get the type of attention that we have gotten during the pandemic. But I've been working as your health officer since August. And prior to that, I worked very closely with Dr. Andy Corin when I was asked to start the family medicine residency program for Adventist Health, which I did. And Dr. Corin and I worked very closely in that capacity. So he's an excellent doctor. I've been meeting with him already, and I will be retained, continuing in a capacity as a consultant to public health through December 31st. That role will be to support Dr. Corin, but until Dr. Corin begins, which will be in about a month, I am continuing to be your health officer, but I am close contact with Dr. Corin, and I'm getting him ready to take on this role and asking him to start in particular focusing on schools and the skilled nursing facilities. And actually, I do want to end up to mentioning at Sherwood Oaks, where we do have our first skilled nursing facility Outbreak in Fort Bragg, and all across the state and all across the country, when we've seen COVID surges happening, as we're seeing here in Mendocino County, we often see it first happening in a skilled nursing facility. So all of the preparation we did, it wasn't enough. And this is often what we see across California. So the current data from Sherwood Oaks is we have 11 residents who've tested positive, 7 staff, and 3 deaths. So with that, I will pass it over to Carmel Angelo.
Thank you, Dr. Doohan. So good afternoon. I just have a couple things I would like to report on. In what Dr. Doohan was talking about with Dr. Corin coming on, we're very happy to have Dr. Corin joining us as our next health officer. And Dr. Corin will be coming on. He will be full-time, and that will be within the next month or so. We're hoping by September 1st. In the meantime, Dr. Doohan remains as our health officer. We are in excellent hands with Dr. Doohan, as evidenced by all the work that has been happening so far. And as much as we are in the surge, we are handling the surge well. So, and you are handling the surge well. So thank you. So, but I wanted to be clear because I personally have been getting many questions about how is this going to work with Dr. Doohan and Dr. Corin. And I would like to say that this is an embarrassment of riches to have two excellent physicians that are working in public health with us and working for this community. So Dr. Doohan will be intimately involved in all decisions within public health over the next few months. The exact date of the transition between the exact title of health officer between Dr. Doohan and Dr. Corin, we're not quite sure on that date right now. Dr. Doohan has been our contact with the state. She is well respected and well liked at the state level. So she will be assisting Dr. Corin with that liaison with the state. So we're very happy to be welcoming Dr. Corin into public health and working for you, the community. And that should happen within the next month or so. I also want to say that one of the areas that we need to put more resources toward is around outreach and education. We know that you hear us talk about masking, you hear us talk about 6-foot social distancing. We know that we have information out there, we have some flyers out there, but what's happened most recently is the chambers in the cities have developed a campaign. It's a Mask Up Mendo campaign. And they came to us and they asked us if we wanted to participate in that campaign. And we jumped at the opportunity. So we will be working with the chambers with the Mask Up Mendo campaign. We are really pleased. This is a grassroots campaign. It will be in all areas of the county. And we personally want to thank the chambers in our cities for stepping up and doing this. And we had a Zoom meeting with them earlier today. They are very excited and we are very excited to be partnering with them. So I wanted to assure the public that through the great efforts of the chambers, we will have more outreach and education out there around masking and social distancing. Along with that, North Coast Opportunities has also stepped up and they will be doing some targeted outreach and education for Mendocino County and for the public. And we have asked them if they will assist us in targeting the Latinx community. As Dr. Doohan spoke earlier, we know that this is a community where COVID is increasing and we need to get in front of it as quickly and as best we can. So North Coast Opportunities will be helping us with outreach and education within the Latinx community and also within the youth. We know that's another area. An area where COVID is increasing is between the ages of 25 and 45 and 18 and 25. And so we are asking North Coast Opportunities to work on a campaign to reach out to the youth with the same message around masking and social distancing, no gatherings, everything that you hear us talk about. So today I am really happy to be able to report that to the public. These are really good community agencies that are coming forward and are stepping up and are going the extra mile to help the community and public health with these efforts. So thank you to those organizations. I would also like to say that last week we put out a press release around the business outbreaks. Dr. Doohan has talked about this, and she's been working with our business community along with a couple of our supervisors. We've had those outbreaks and we've developed a process that will come out of environmental health, which is part of public health, where they will be working with Dr. Doohan and we will have a very specific process on business outbreaks. and environmental health will also be doing uh, um, reviews of those businesses before they actually reopen. So that is something we've been working on, and we think that this process will make it clearer to the businesses, and certainly it will standardize what we do, and it should actually improve the communication effort and getting that information out there. I think that really I don't have much more to say. We know that the county offices are open by appointment only. We do have our 24-hour services that are continuing, of course, child welfare, adult protective services. Certainly our sheriff and our deputies are out there every single day, 24/7. Our probation staff is out there, our emergency medical services staff. So while the county offices are closed and just open for appointments, we are doing and providing as many services through this time as we can. And our meetings, our Board of Supervisors meetings are still happening via Zoom as well. And that will continue this month and next month, and we will reevaluate in September. So really, I don't think I have much more to say, except I want to again thank the community-based organizations that are stepping up and assisting us, and certainly thank Dr. Doohan for all of her good work and Dr. Corin for joining us. So thank you.
So we have quite a few questions in our comments, so I'm going to try to get to as many as we can. The first question we have is, how far behind is the county with contact tracing? Are we able to trace within 2 to 3 days?
I do not have that information about contact tracing at this moment. I would need to ask our CD team where they're at. But what I can tell you is that we're ramping up. We're focusing on the California Connection resource, which will help us with case investigation contact tracing. And we're getting contact tracers, case investigation contact tracers trained through a state resource. So we would have to get back with that information in particular from Becky Emery.
Sarah, I also want to say that we did put in a request for mutual aid for contact tracers from the state, and they should be arriving before the end of this month. We put in for 10 contact tracers. The area of need, I would say, as Dr. Doohan had talked about earlier with contact tracers, is really Spanish-speaking tracers. And that is obviously a need throughout not only our county, but other counties as well. I don't know that I would say that we are far behind with contact tracing. Certainly our numbers have jumped up, but we have trained more people, as Dr. Doohan said, and we continue to train. And my hope is that when our state contact tracers arrive, that they will fill that gap that we have. So thank you.
We also have quite a few questions around tourism, whether tourism is actually safe right now, and if we should be considering shutting down tourism. So if you could speak to that.
So I am not planning on making any changes to tourism to my orders. They are standing as they are. What we don't know, we don't have data about how tourism is impacting us because unless it's someone who lives in Mendocino County who's a worker in the tourism industry, we cannot say how many of our tourists have COVID, because the way that COVID is reported is through the county where a person resides. So if someone came for a weekend to Mendocino County, they had COVID, they spread it, and they left and went back to their own county, we would never know. So I would say that it's to the extent that the tourists, when they come to our community, are wearing facial coverings, are practicing social distancing, and are not coming here if they're sick, that's to the extent that tourism is safe. And that is why we're so grateful for this campaign of Mask Up Mendocino, so that when people do come to our community, they do wear facial coverings that cover the nose and mouth, and that they social distance. As well, that is why we've developed posters and flyers on our website that businesses can put in their windows to let visitors know that in Mendocino County, we social distance, we wear facial coverings.
We also have another question asking about what is being done to crack down on all of the gatherings going on.
Well, one of the things we're doing to crack down on the gatherings is to say to the public, the governor has banned gatherings. We know that this is one of the areas and ways that COVID spreads like wildfire. We're asking the public to comply with the ban on gatherings. in terms of enforcement, I apologize, Carmel, but I think I'm going to have to pitch that question to you. It's a very difficult question. We have challenges with enforcement. We do know that, but I would like to know, Carmel, how you might want to respond to how are we enforcing gatherings from occurring?
Yeah. If we are notified about a gathering, we respond. And I am well aware that Sheriff Kendall has received calls. Certainly the Sheriff's Office has received calls on the weekends about gatherings. They have followed up on those gatherings. You know, this is a real challenge for us. There's 90,000 people in the county. You never know when somebody's going to have a gathering, a party, a graduation, a first communion, whatever, a birthday party. It seems to be an area that people still move forward with. And of course, when we say a family gathering, I might be talking 2 people, another family might be talking 12. So it is a challenge, but I'll tell you just very briefly what we are doing with enforcement. You know, enforcement is a big issue for the Board of Supervisors, and at every board meeting, we have an update on COVID and we have an update on enforcement. Our process with enforcement is you can call the call center, and certainly after hours you call dispatch, but you certainly can report an enforcement issue to the call center. That issue then goes to our special investigations unit that is run by John Martyr. And when the special investigations unit gets the report, they go ahead and triage that. If it's a business, it will go over to our code enforcement office, which is in planning and building. And they have ramped up to enforce the public health orders. So that is one area of enforcement. The other area, of course, is with special investigations unit themselves to go out and deal with members of the public. Again, remember, businesses go to code enforcement. And then we also have the administrative process at this point too, where we have an infraction process where the deputies can write tickets for an infraction, and they can be out there basically monitoring what's happening. So enforcement is a tough issue. We also have enforcement with isolation and quarantine orders, and we've had to hire private security to help us with that. When we put someone in isolation or quarantine and they're non-compliant, we will actually have someone outside of the hotel room that they're in or wherever they are to assure that they stay in isolation or quarantine. Enforcement is a whole nother topic. It's just a whole nother issue. However, as many resources as we have with enforcement, whether it's the sheriff's office, whether it's probation, whether it's our planning department, code enforcement, whether it's special investigations unit, you know, or private security, there's never enough enforcement. So we're doing what we can at the direction of the Board of Supervisors to work on enforcement. And again, our hope is that some of these community-based organizations that are doing these grassroots projects like Mask Up Mendo, something like that, where we actually have a presence, where people are out there doing education and outreach, we hope that that will help to reduce the need for enforcement.
We have quite a few comments regarding first responder testing. A first responder can't seem to, there's no testing available. So the question would be, if you're a first responder and you're having a hard time getting tested, where can you go? Who can you contact? Also, along those lines, people are commenting that it's very hard to get an appointment at OptumServe right now and wondering if that will be a resource in August that they can access.
Well, with OptumServe, I would have to defer the timing questions and the questions about appointments to Becky Emery, because I don't have that data as of today about when the next appointments are available. But OptumServe is our resource from the state that provides free testing for surveillance purposes. And I'm assuming that's what that first responder was asking about. So, you know, or the first responders, but OptumServe is priority population that we want to have OptumServe available for is surveillance testing of first responders. So I think perhaps if there's a particular group of first responders that could send the information to Sarah specifically about what issues you're having with getting, but that's OptumServe is for you. We want to do surveillance of our first responders.
So if you're a first responder and you're having a hard time getting access to testing, should you contact public health?
Call the call center and
Okay.
give us that information.
Great.
You know, I want to comment on OptumServe. Everything Dr. Doohan said is absolutely accurate. It can take 1 to 2 weeks to get an appointment scheduled with OptumServe. When you talk to people that are doing testing, that are getting tested every 2 weeks, when you go for your test, make an appointment for your test for 2 weeks out. I know that it took me 11 days to get my results of my last Optum test. At the same time, people that went in that I know of at the same time I went in, got their test results between 4 and 7 days. So it really is, unfortunately, a national problem when it comes to testing. Optum is the best that we have. If you are a group of first responders and there's a reason that you think you need tested other than the standard every 2 weeks, certainly you contact us in public health, and we could do everything we can to arrange testing. We do contact testing out there, as you know. I don't know that you're talking about contact testing, but we will do what we can. And there are other resources out there, but Optum is really the key resource for surveillance testing in our county right now.
And it is for surveillance testing for people who are not sick or for people who have not had a close contact. That's the purpose of OptumServe. And all across the state, we're short on the testing resources, whether it's the viral transport medium or whether it's the reagents. And the delay is not on our part with the results. It's at the lab in Quest, the Quest lab in San Juan Capistrano, because they're so backed up.
We have another question asking for a breakdown of community spread by region. I know a lot of cases are under investigation, and I do have a breakdown for the ones that we do know for region. So I'm just going to go ahead and share that. Right now, we've 3 of the community spread cases are in the North County, and 22 of them are in the Ukiah Valley. We do have a lot under investigation, and so those numbers will change as we get more. And we are working on new data to include in our dashboard, so stay tuned, and we're taking your comments on what you guys want to see on that dashboard. Another question wants to know how many people were involved or how many positives from the dentist office on the coast.
I believe there are 2. One for sure, and one was suspected. And we haven't had any more information from that because we're waiting for the outbreak testing that was done in Fort Bragg that was in collaboration with Mendocino Coast Clinic. We have not got the results back of that testing yet, and we're expecting that today. So when we get that back, we'll see if any other individuals who tested positive were related to that office.
We also have another question asking, are we on the state watch list?
As I said in the beginning of my presentation, we have not been placed on the state watch list yet because the state's data is about 14 days behind our data. But I've been in contact with the state daily, telling them what our data is. And so by the numbers, we should be on the state watch list, but we have not officially been placed on it. However, we had an emergency meeting put on our calendars for this evening at 6 o'clock from the state, and we'll find out more when we have that call.
We have another question asking, is there any more information regarding the death at Howard Hospital that you can share?
We do not have that information. That would have to be something that would come from the hospital. I can only say that it was someone above the age of 65 who was not from a skilled nursing facility.
We have another question asking, are the parks going to close?
I'm not planning to close the parks. I haven't heard that the governor is, so that's not something I'm aware of.
Another question we have, at what point does a business have to disclose a positive COVID case from an employee?
Well, we know the positive cases once we get the reporting to us, so we report it to the individual and we encourage them to tell their employer. And then we would tell the employer ourselves if we didn't think that the employee was going to do it, or if it was a very high risk setting. The employer should not be receiving the results ahead of the employee unless the employer is a healthcare facility who did the testing themselves.
Another question we have is about Spanish-speaking contact tracers, and if those are county employees or are they independent contractors?
Well, we have some county employees who are doing that role, but we've also put a call out through the disaster health volunteers for Spanish speakers to come forward to be contact tracers, case investigator contract tracers, and then also the resource that we're getting from the state of the case investigator contract tracers. We're hoping that they're going to be providing us with bilingual people. And those, when I say providing us, the good thing is it's virtual. They don't actually physically have to come to Mendocino County. They can do the work from their home. But there's been such a demand for case investigator contact tracers from the state that we did put in that mutual aid request, but we haven't been able to be provided it yet.
We have another comment of why are other counties like Santa Clara allowing outdoor gatherings under their variants, but we aren't?
I am not aware of what that person is referring to or what is happening in Santa Clara County regarding allowing gatherings. Gatherings are banned by the governor. So I don't know what that refers to.
Okay. We have another question. Is there community spread in the North Coast? And like we said before, right now we have confirmed community spread in Ukiah and in the North County, but that could change as our cases under investigation are completed. And
everything that I've observed is indicating we have community spread in our entire county. So just, you know, as we're doing the contact tracing, there are times when people just don't know where they got the COVID virus. And again, our reporting back from the labs is 10 days behind when the tests were done. So I'm just, the picture we're about to give you, we are able to give you today is from the results that we have from tests that were done 10 days ago.
Is there a plan in the future to meet with business leaders in the community to get their perspective on what is happening in our communities with regards to people following the health orders and the struggles we face?
We've been having those meetings now for months, convened by Supervisors Williams and Jurdy with West Company. So those are ongoing, and I'm not sure about the second half of the question about what people face. What is
yeah, like to get feedback on what people are facing in terms of people not following the health orders.
Well, those meetings with the business community are ongoing and happening.
I've heard people are waiting for 2 weeks or more for the results of their surveillance testing. Is this true?
Yes. Well, it's usually not more, but again, we're dependent on UCSF and OptumServe uses Quest for those labs which are heavily impacted by what's going on across our state of California. And so we haven't heard more than 14 days, but we certainly have been hearing 10 to 14 days.
We're getting some comments about people calling in for large gatherings, and there's not much follow-up because the special investigation unit is not working on the weekends. Is there a plan to have more follow-up on calls for the weekends when people are having parties?
Sarah, this was an issue that came up. The special investigations unit is working on the weekends, and how that works is they have people on call. So if there's a call, you're going by and your neighbor's having a party at 2 o'clock in the afternoon, you can call dispatch and they will contact the special investigations unit. This was an issue on Tuesday in front of the board. We've dealt with this. We want SIU to be working on the weekends. We want enforcement on the weekends and not just the deputies out there. And so I assure you that they are available to respond on the weekends.
We have still a couple questions around tourism, wondering at what point, if the cases go higher, will the county consider closing tourism?
I'm not considering closing tourism at this time. What I've done is limit tourism by putting restrictions on lodging in terms of the number of rooms that they can rent. They have to keep a certain percentage on reserve, and they need to keep a certain downtime in between when rooms are rented. And I'm not planning on further restricting lodging or further opening up lodging at this time. So I'm holding the line with lodging where it is. So I'm not planning on making any changes, but we have to see what happens next. mean, we're just shutting down some more sectors in response to the watch list criteria. And we want to give that time to see if that flattens the curve and slows the spread so that we stop having 10 cases every single day and a 2% death rate.
What are the testing recommendations for essential workers? If an essential worker gets voluntarily tested without showing symptoms,
Sorry, I lost the feed.
Oh, can you hear me?
Oh, I'm sorry, I lost the feed.
Can you hear me?
I can hear you now.
Great. So the question's about what are recommendations for essential workers, and if they get tested for surveillance and they have no symptoms, should they be isolating for 10 to 14 days?
Well, there's a lot of confusion about what an essential worker is, and so that's a kind of a question I'm having a hard time answering, because only a person who's had a close contact with a COVID case or somebody who has symptoms should either be isolating or quarantine. And surveillance testing wouldn't be used for either of those reasons under normal circumstances. So if a person who's an essential worker, a critical infrastructure worker is what we call it, if they're working in a setting where there is crisis level of shortage, they can get an exception to quarantine, and that's spelled out in my quarantine orders that were released last week. So exception to quarantine is only for critical infrastructure workers if their workplace is having crisis level shortage. Someone who is sick is never excused from isolation. So isolation is a strict requirement. Quarantine, we do have exceptions to certain categories of like public safety, law enforcement, healthcare workers can get exceptions to quarantine, but that is in accordance with their workplace and the rules of their workplace.
So we're getting quite a few questions about casinos. Why are casinos open and should they be closed?
I have no information about casinos.
So just to clarify, I think all of the casinos that are on tribal land.
Casinos. Oh, I'm sorry, casinos. Casinos.
Yeah.
I'm sorry, I misunderstood, because casinos are on tribal land and the public health officer has no jurisdiction on tribal land.
Sarah, while you're looking at that other question, I would like to thank Julia Conway for sending the Santa Clara County Gatherings Guidelines. I just received that via email, and I will share that with Dr. Doohan for review. So thank you.
We have one comment where the Mendocino coast has opened up wide. What happened to the shelter in place in traveling 50 miles? Has this been thrown out?
No, we're still sheltering in place. We still have sheltering in place orders, which you can read on our county website. And within our sheltering in place orders, there's a limitation for non-essential travel of 50 miles straight line on a map. But I can't control what people from outside our county do. We are sheltering in place across the state, but we can't close down our county lines. That's not possible. So we just rely on people making wise decisions. We're still sheltering in place.
So we have a question regarding RCMS. So she says, I see 3 listed for the South Coast for positive cases, but I know that 4 more cases were confirmed recently at RCMS. Will that update soon? I think she might be referring to some people that tested positive that may not be county residents.
Yes, that frequently happens. Yeah, and people should keep that in mind, that again, COVID, like any communicable disease, is reported through the county where you reside. And there are quite a lot of people who work in our county but don't reside here. So when they test positive, they come to a clinic on the South Coast. They may reside in Sonoma County. We would not be including that on our tracker.
Has there been a positive test associated with Safeway in Fort Bragg?
Not recently.
What are the current requirements for places of worship? Outdoor services with social distancing and masks, are those okay? Is there a maximum number of congregants that can attend an outdoor service?
Yeah, so the new orders are that places of worship must, starting with midnight tonight, hold their services outside, and we're limiting it to 100 people, which must have social distancing and must wear facial coverings. And also the governor, not me, banned singing.
We have another question. Can we expect to see a breakdown of positive cases by zip code for our county? Because Mendocino County is so spread out with lots of different regions.
That's not something that is not something that we've been contemplating at this time. We're reporting by regions. I think we've gotten beyond the point with this pandemic where one has to wonder if there's cases in your community. I would just tell you there are. Not everybody's getting tested. We have widespread COVID spread all around our county. So I'm not contemplating reporting by zip code.
And there's a related question of, are we going to see at least more breakdowns of, or more refined breakdowns of region? A lot of people are asking about their specific cities.
I wouldn't be planning that until we could be sure that privacy wasn't affected. I would just tell people to assume it's in your community. If we get to the unfortunate point where it's widespread in every village, every town, then we could do that. But at this point, it might lead to loss of privacy for individuals.
What is the county doing about the homeless camp at the Talmadge Bridge?
I don't have information about that at this time. Carmel, do you?
I do not. And I have to say, I am not aware of a homeless camp at the Talmadge Bridge. So I guess I'll have to drive over that and see. So yeah, that's something we could certainly look into. No information. Is this, well, obviously you don't have this information, Sarah, but I'm assuming this is a new homeless camp, because the city took down their homeless camp that they had that was over by the airport. And and at that point, we were taking people out of the camp and certainly out of the shelter that needed a hotel room, needed to either isolate or quarantine for some reason. And so we have still been working with the people that have been in hotels with Project Room Key. But I'm not aware of a shelter, of a camp under the Talmadge Bridge.
We have another question coming in. How many people are currently in quarantine? And is there a way we can get that information broken down by region as well?
Sarah, do you have that data in front of you? I would have to look at that.
I do for quarantine. Our current quarantine numbers are 166. I don't have them broken down by region.
But they tend to track with the cases in similar proportions.
Yeah, I do have a breakdown of the active cases by region right now. So there's 14 active in the North Coast, 3 in the South Coast, 1 active in the South Coast, 18 active in North County, 4 active in South County, and 80 active in Ukiah Valley.
And each of these individuals in isolation gets called on a daily basis by our communicable diseases team to check on them, to make sure they're maintaining isolation, to make sure they have food and support. And the quarantined individuals are checked on as well. So as we surge, there's a great deal of work on the part of the communicable diseases team to continue actively monitoring these individuals and then informing them of when they're released from isolation and quarantine.
We have another question related to homeless. Do we know how many positive cases are from the prison release and the homeless population?
There's no positive cases that I'm aware of in any recent time from the population experiencing homelessness. From the prison population, that's a different set of data because we have people that are being paroled. We've done quite a lot of work with law enforcement and with the leadership in our county towards getting information in a timely fashion when these individuals are released. And I think we're doing a pretty good job at this time that these individuals are released. If they're homeless at the time of their release, we put them in motels. And that's when Carmel was speaking about earlier that we have security if needed. So while we may have gotten people that are needing to be in quarantine, we are getting them straight into a hotel when they arrive, and then we're making sure they remain.
So we have time for one more question, and it's when will we be getting the test that shows if someone has already had COVID? And I think they're referring to the antibody test.
Yeah, so that is a test that people can order. You know, they can ask for it to be ordered from Quest Labs, I think is doing it, but we don't know what it means at this time. It doesn't tell you that you're immune to COVID, that you can now go around other people with COVID. It's more for research purposes still. So I have not heard at what point, any information about what point we might be able to use that for actually proving someone has immunity, which is the reason you would use an antibody test.
So that concludes our COVID-19 Facebook Live update. We will be back in just a few minutes taking questions from the media for our press conference. So stick around to listen to the questions from the press, and we'll see you again next Friday. Have a wonderful afternoon and weekend. Good afternoon, Mendocino County. We're here today for our press conference with our media news outlets. So we're going to start by doing a round robin with our media to ask Dr. Doohan a question, and then we're going to turn it over to Dr. Andy Corin, who is our recently appointed health officer. He'll talk a little bit about himself, then we'll do another round robin with the press. So with that, I'm going to go over to Sarah Reith with KZYX.
Thank you. Can you hear me?
We sure can.
Okay. Well, thanks for having all these briefings today. And I'm wondering if with the renewed commitment to communication, especially in English and Spanish, I'm wondering if local media outlets and our audiences can begin to expect a more regular schedule of briefings and a return to local outlets having one-on-one interviews with the public health officer.
Well, Fridays are our media days, so we've been sticking to that for many months now. I think it started out Thursdays in the very beginning, and it's moved to Fridays. That at least is regular. It's every single Friday. One-on-one interviews, I'm not seeing that being possible with the pace of this pandemic at this time, because we are dealing with so many things continuously. So that's just with me. So there's others on our team that could provide other responses to this, but in terms of my accessibility, it is on Fridays, and I am having to do this group interview format because of all of the other work that is needed from me. But any thoughts on that? Yeah.
Well, I meant it at the same time on Fridays because it's been 9 o'clock and 2 o'clock and then 3 o'clock, and I think it's tough for people to get into a schedule where they know what to expect at what time.
I think our goal is to get some type of a regular schedule, and hopefully in the weeks to come we can work on that. But we have had some big outbreaks and different things and state calls, and so it can often be very hectic through the week. But we hope that we can get some regularity soon.
Oh, thank you.
Especially when things, cross our fingers, slow down.
You're muted.
We'll head over to Matt with KMUD.
Hey, Dr. Doohan. Okay, I have sort of an extended question, and it has to do with 2 CDC documents that have come out, and I just need a qualified public health officer to help guide me through. So yesterday, they released the new guidelines for reopening schools and really emphasized the importance of schools and that not opening them could have negative health consequences, and they wanted to provide guidelines to be able to reopen the schools safely and effectively. But today, they came out with a case study of New York City cases that said even young adults without underlying chronic medical conditions could have long-term effects from COVID-19. So upon initial reading, I see these pieces of information as almost conflicting. Are they in fact contradictory? How, and I guess from your perspective, how would you navigate those 2 directives or observations by the CDC?
Well, I think the guiding principle is that local can always be more restrictive. So what is coming from the CDC at the federal level is we can be more restrictive at the level of the state, and then we can be more restrictive at the level of the county. And where I have stood from the beginning is I'm going to follow the governor on schools, on the state leadership on schools. So I have not closed schools, and I've not been more restrictive than the state, but I am following the state, and it's our state, that has made the restrictions that came out late last week on school reopening, that counties that are on the watch list will have to go to distance learning unless there's a waiver requested by the leader of the school, if that's the superintendent, the labor unions, the community, and the parents. So that's the situation we're following in Mendocino County, is what's coming from the governor from the state level, which is that watch list counties need to go to distance learning unless there's a waiver process. And the reason that we are following that guidance in the state of California is certainly in the state of California, the decisions on the governor have mostly been guided by science and facts. In some cases, there's political pressure, but I don't think that the political pressure has led the governor to do what he's done around schools. I think that's been guided by science and fact in California.
Thank you for that, Doctor.
So we will move over to Adrian with Amanda Voice. And we're gonna need to.
Sorry, I had the mute button on.
Here we go.
Hi, Doctor. Thanks for doing this lengthy, now what is it, going on 2-hour process. I'm wondering, I know you've repeatedly said, you're trying to put out fires and you don't even know where the fires are because the testing data is so delayed. But I'm wondering if you can give us some sense of if what we're seeing is a 4th of July party surge, or if we're just in the middle of a continuously growing line, or if there's any sign that perhaps the number of cases isn't going to decrease, but at least the rate at which the things are getting faster will slow down. The acceleration will slow down. If you can give us any sense of that.
So, in public health, we talk about the burden of disease, and I think the burden of disease in our county is high, relatively speaking, so that we have community spread. And then what we're seeing is that in those groups that are still needing to go to work, and maybe they're even working in multiple jobs, they have to go to work. They don't have the luxury some other people do of working from home all the time, or even taking time off from work, but they have to go to work. I think we're seeing definitely these what we could call frontline workers that are working in multiple jobs being the source of some of the spread. So it's in no fault of their own. It's just they need to work, and they are in fact frontline workers in essential businesses like grocery stores and nursing homes. So I think that there's that baseline going on that we've seen in every county across California. For those of us who've been watching COVID from the beginning, it's gone this way in every county. The grocery stores get outbreaks. The skilled nursing facilities get outbreaks. So we're seeing that. But also what we know is that there's people that are having large gatherings, and they are continuing, and those are definitely driving the spread of COVID as well. So it's just the burden of the disease is rising up in our county, and it's continuing to spread because we're not socially distancing the way that we were before the governor opened things up in April. So do I think it's going to slow down? Not anytime soon. I think we're in the beginning of our surge, our serious surge. And the modeling data from the state was that it was going to hit us very heavily in the beginning of September. And that's why I believe the governor has made the strong move that he has about, strong in terms of very restrictive move about going to distance learning for watch list counties. Those counties that are on the watch list, we're not expecting to come off of it before September, before October, November. We're expecting that we're going to see these level of cases. The benchmark is 100 cases per 100,000 people in 14 days is one of the hallmarks of being on the watch list. And we've exceeded that 100 cases per 100,000 people in 14 days. And we're not seeing any signs of that slowing down.
So a couple weeks ago, you said that it was expected that there would be at least 50 COVID patients in Mendocino hospitals. I think we have 16 ICU beds and a total of 100 beds. So that gets to the point where it's beginning to overwhelm our capacity. Is that still the expectation that we're going to hit that number, or have the restrictions the governor put in place and you yourself put in place, are they beginning to pull that back, and maybe we won't hit that critical number in the hospitals?
So Adrian, that data came from the state. So you can look up, I think we talked about, there's what do they call it? They have different names for the different trackers that they have at the state. So I got that number off of the state website. The state's data tracking for us is several weeks behind our reality on the ground. So I would just urge you to look on that state website to see I haven't looked actually this week at what the state is estimating our number of cases would be. But we are seeing a doubling time of about 14 days. And right now we're at about 100 new cases in 14 days. So if we don't slow it down, we'll see you know, 200, then 400, then 800, you know, with a doubling time of 2 weeks, it wouldn't be surprising to see 50 in the hospital in the fall, unless we slow this down, unless we flatten the curve and slow the spread. That's what we try and do with our case investigation contact tracing. But when we have 100 people in isolation and then all their contacts, it becomes quite a big effort to try and contain that. So we have containment, we have mitigation, and we have communications as our weapons. The mitigation is where our power is right now, to people wearing masks, socially distancing, and that's why the watch list counties are moving activities outdoors in higher risk businesses like gyms.
Mm-hmm. Thank you. My second question is, are businesses under, this was asked earlier by, are we doing 2 questions right now or 1?
We're doing 1, and then we're going to swing back around with Dr.
Go ahead. Sorry about that. Thank you, Doctor.
No problem. Jackie?
Sí, el día de hoy entra en vigor una nueva orden en el condado de Mendocino y algunos propietarios de negocios latinos no saben si su negocio está dentro de la lista de los que deben de cerrar. ¿Podría mencionar qué tipos de negocios se van a cerrar a partir de las 11:59 de la noche? ¿A dónde tienen que llamar los propietarios de estos negocios para asegurarse si tienen que cerrar o no?
Okay, today a new order goes into effect in Mendocino County. Latino business owners don't know if their business need to close. What kind of businesses should be closed after tonight's order? Where do businesses should call to find out if they have to close?
So the summary document should be on our website in Spanish, summarizing the changes of this new order. No? Is that a no?
So we have the order in Spanish. The main provisions that changed were the personal care and
there's more than that. So we should get
the order is online in Spanish. We did not do a summary of changes for this order in English or Spanish.
Okay, so we should do that. We should get that ready, but it's the same across the state. So on June 28th, the governor closed for all of California indoor dining in restaurants, movie theaters indoors, wineries and tasting rooms, and brew pubs and bars indoors. So those were, if you want to say that, George.
Yes, sure. Okay. Pronto vamos a colocar en la página web del condado un resumen de todos los negocios que estarían acogidos a esta nueva ordenanza. Sin embargo, todas las actividades que se pueden realizar dentro del negocio van a estar suspendidas. Entonces, por ejemplo, restaurantes van a poder permitir atender al público, pero afuera. Igualmente, se van a cerrar los cinemas. Los viñedos para probar vinos van a poder hacerlo, pero también igualmente afuera de sus instalaciones. Los bares y tabernas también van a cerrar actividades dentro y van a poder ofrecer algo afuera de sus instalaciones.
And bars and brew pubs needed to close by the governor's order on June 28th, unless they served food, and then it could be outside. They could hold business outside.
Ok, hay una precisión con relación a los bares y tabernas que estas tienen que cerrar a menos que sirvan comida. Si sirven comida, entonces esta va a poder ser servida fuera de las instalaciones de los bares y tabernas.
Then what comes into effect tonight at midnight is with what we see with watch list counties. This is closing indoor activities in gyms and personal care facilities, like where you get your hair cut or nails done. These must move outside.
Ok, igualmente los gimnasios van a tener que cerrar actividades dentro y poder funcionar afuera de la misma. Lo mismo con servicios de cuidado personal, como por ejemplo el cortado de cabello, las uñas, o alguna actividad en la cara, también van a poder funcionar, pero fuera, al aire libre.
Additionally, places of worship will need to have their worship ceremonies outside with a maximum of 100 people.
Okay. Y actividades religiosas, estas van a poder ser llevadas a cabo igualmente fuera de instalaciones del templo y con un máximo permitido de 100 personas.
And the final category that is offices for non-critical infrastructure, which is complex to determine if the office is critical or non-critical. The point being, if an office can have its workers work from home, that is going to be the best function.
Y centros de trabajo en las oficinas igualmente también van a tener que acogerse. Ellos van a tener que optar de poder a sus empleados trabajar desde casa. Do you think that for
non-critical infrastructure offices?
Okay, para oficinas que no realizan un trabajo, una actividad crítica de servicio a la comunidad.
Like the government.
Como,
Like
por ejemplo,
government offices.
Como por ejemplo los servicios que ofrecemos acá en el condado. En algún momento también van a tener que evaluar quiénes van a poder trabajar de casa y quiénes no.
¿A dónde pueden llamar los negocios para cerciorarse, para verificar que sí pueden o no pueden? ¿Hay algún número de teléfono aparte del call center?
Okay, there is any number in which, for instance, if somebody is in doubt, then in order to be more specific and clear, what kind of business could be open or could need to be closed?
Yeah, and I do want to say this is exactly in alignment with the state. So it's nothing different than what's happening at the state, but it would be the call center.
Yeah, and we have we've increased the amount of Spanish speakers at the call center, so they can brief if they have any questions about the orders.
Okay. Bueno, sigue siendo la central telefónica. Ha incrementado la capacidad de personas que puedan contestar en idioma español, si es que aún hay alguna duda de qué negocio puede estar operando o no.
And next, we're going over to Mike with Willits Weekly. And you're on mute, Mike. So you're going to want to unmute yourself first. Mike? Oh, there we go.
Now I'm good? Okay.
Yeah.
Hi. How many questions do I get?
One question for Dr. Doohan, and then we're going to do a next round robin with Dr. Corin.
Okay. Let's see. So yeah, I'm trying to figure out my question, but I do have one question. Dr. Doohan, the watch list. You kind of have run down what changes happen with a watch list, and they're somewhat minor. You know, gyms, personal care, places of worship. Am I missing something? Is there some heaviness that's lurking out there in being placed on a watch list that I'm not aware of, that they can maybe, are you aware, you know, they might do something to us that they're not telling us? Or what do you think?
Well, the sectors that were chosen by the governor to shut down if we get on the watch list are indoor operations for sectors which promote the mixing of populations and make physical distancing, facial coverings difficult, like gyms. And I think that there are many people who do not think that the closure of these sectors is minor. I think that's very controversial to close them. Places of worship, saying that places of worship need to hold their worship outside is very controversial. But it's being done because what we're seeing in California is so alarming with COVID. We've had 5 deaths in Mendocino County, 4 of them in the last week. We have 6 to 10 people in the hospital every day, some of them in the ICU. We have 100 active cases in isolation. This is happening. It's here now. For so long, we didn't have anyone in the hospital. We didn't have any deaths. We had no cases for weeks. Now this is what we're seeing is real. What happens, and also the implications of being on the watch list for schools is very, very serious. The governor has said, if you're on the watch list, you must go to distance learning, unless you ask for a waiver, which, by the way, the health officer is an intermediary to that waiver. The health officer takes the waiver up to the state and the state decides. So this is very serious. And what happens if a county doesn't comply with the governor? We've already seen that the county will have threats to not receive state funding. And I think that, there are many resources that we've received in Mendocino County. For example, the Abbott ID Now testing machine that's going to Fort Bragg, which is such a terrific resource with 30 test kits that's going to the Mendocino Coast Clinic. That would not have come to our county if we hadn't been doing everything possible that we could do in Mendocino County to comply with the governor's orders and to also make very smart decisions based on public health decision-making and not caving to political pressure. So the other resource, OptumServe, we would have never gotten OptumServe if we weren't being such collaborative and good, county in terms of responding to the pandemic. So imagine what would be like for us if we didn't have OptumServe. We would have no chance at responding to these outbreaks that we're having, no chance. And now that we're getting the Abbott machine on the coast, I think we'll really be able to do a better job there. So what happens if you don't comply is not only do you not get resources, but we will not get, I believe we would not get funding. Carmel Angelo could, I'm sure, speak to that better than I can because she's a very experienced leader at the county level. I'm new to government, but I do understand that that's what happens with the state when you don't follow the governor's orders.
Thank you.
Oh, you're on mute, Sarah.
Oops. With that, we're going to go over to Dr. Corin to just talk a little bit about himself to give an introduction, and then we'll do that same round for questions for the doctor. So over to you, Dr. Corin.
Okay, let me first start by saying my internet connection has been really funky today, and I hope this will all come through. I'm going to let you know that I'm a family physician. I've been for 44 years and have been practicing here in Doohan for 30 years. I came initially trained at Northwestern University in Chicago and worked at Cook County Hospital and in the communities there, and then came to San Francisco, where I was trained in San Francisco General Hospital under the auspices of University of California, San Francisco, and practiced then in the community clinics, in particular Mission Neighborhood Health Center, which is a Hispanic community clinic that's grown since the time that I was there quite a bit. I've worked for public health as a physician there, and then I moved up to have my family in the city. And I did take a little leave from the county to teach up at University of Washington in Seattle. People have asked me what contact have I had with public health, and I don't have the skills that Dr. Doohan has, don't have the degrees in public health, but I do know the community here, and I have been on the Public Health Advisory Board several years ago, at the time actually when we were making some major changes in public health and social services. So I have some familiarity with the government public health system. My role as public health officer hasn't started yet. I'm just been named by the county board of supervisors, but I'm hoping that my relationship with the community, the various members of the community, locations in the community, first of all, it needs to grow. I need to have more information in order to solve the problems we're in. As you know, and as Dr. Doohan has not very limited. We're not at a point where we can respond to it with not only because we don't have the president hasn't released the dollars for developing the test kits and so on and so forth, but also because the technology is not at the level that we would expect medicine should be at. But it's a new disease. So what do we have to work with? We have, we have the masks, social distancing, trying not to have large gatherings, basic human relation kinds of weapons. That's our weapons against coronavirus. And the problem is, how do we solve that and keep businesses open, keep people employed, keep people getting education through the schools? And we don't know. And so my role is going to be to try and help the community solve that. And it's going to come through.
If you can hear me, Dr. Corin, you're frozen. Try turning off your video. Okay, I see you moving again. There we go. I think that will help.
Yeah. Oh, I can't start the video now.
I think if you keep the video off, your internet connection will be a little bit better.
Thank you. So are there any questions?
So with that, I'll do the same order. So Sarah?
Can you hear me?
Yes.
Okay. This is a dashboard question, so I'm not sure if it's time yet for Dr. Korn to get into the minutiae of the dashboard, but we heard a lot of questions about, is it going to be broken down by area? And I see that recently it was broken down a little bit more minutely by racial demographics and age in the last week or two. I'm wondering if we would be able to see a breakdown insofar as it's possible, where we know how the people got this virus, how they got it, since it doesn't look like more closures or lockdowns are going to be appreciated by anybody. But if we have more information about what specifically is causing it, is it going to grocery stores or gyms? How many of them were caused by large gatherings? Can we put to rest the fears of whether tourism is bringing it into the county? I'm wondering if it would be possible to make that information available to the public.
Well, I can answer that. This is Dr. Doohan here. Really data, we want data, we want more data. And I'm constantly, Carmel knows, I'm constantly asking for more data. At this time, we do not have the staff to get that level of data published and shared, because we're right now just trying to respond to the surge. And I think ultimately this is data that would be helpful to have, but honestly right now, we're just trying to keep up with the 100 people we have in isolation and the over 100 people we have in quarantine. But I can tell you, based on what I'm seeing, we have community spread. Often the person doesn't know where they got it. And then we have people like that, and then it spreads to their households. So the initial person didn't know how they got it, and then their whole, not their whole household, but let's say half their household got it. So there's no question that it spreads very rapidly through households. It also spreads through places where people are in close contact and they're not social distancing. So when we had the outbreak in the fire station, that was someone brought it in. They don't know where they got it, but once they were in the fire station, it spread throughout the fire station because they were in close proximity. So we have a baseline of community spread, but then we have a protection of social distancing. So you can just imagine any place where they're not social distancing, they're not wearing facial coverings, and there's not good ventilation, like let's say a fire station where people are in close contact, that's going to be the kind of places where it's spread rapidly.
Next up, Matt.
Dr. Corin, good to meet you. Good to make your acquaintance. So I was speaking with CEO Angelo last week about some of the duties involved being a full-time public health officer. And she described being on call 24/7. And I'm wondering if you could just sort of tell us about your willingness to step into those sort of consistent duties, you know, being that you took the job, you're willing, but maybe how that compares to your previous position, what sort of lifestyle shift you foresee in the new position, and I guess in general, what made you sign up for this gig? What makes you excited to don the mantle of being Mendocino County's public health officer?
We're not hearing Dr. Corin.
Dr. Corin? Are you there?
While we're waiting for Dr. Corin, I just want to make a comment that I've worked with Dr. Corin for the last 5 years before I came on as health officer. And Dr. Corin was famous for being the one who took call for our clinic, which was at 1050 State Street, for months and months at a time. So he is one of, you know, he is a full scope family doctor whose practice.
I could not hear the last part of what Matt, I could hardly hear anything of what Matt said.
Okay.
And then the connection completely cut out. It's just.
Maybe Dr. Corin could call in.
I'd ask Matt to ask his question very briefly.
My questions do.
Or is there another way, Sarah, that I could, you know, communicate? I'll call in. I got your text. Thank you.
So while he's calling in, I just want to say that Dr. Corin is a full scope family doctor who is taking care of hospitalized patients, done labor and delivery, delivered pregnant women, you know, done OB. And in my time in the clinic with him, he was on call for our clinic for months at a time. So that's kind of hardwired into us full scope family doctors, is taking call and being of service. I'm sure he'll answer that himself, but the on-call part, I thought I'd just answer. I know it's normal for him.
Yeah, I think a lot of the 9-to-5ers don't really consider that full scope nature of the family doctor. And when I learned how your gig, Dr. Doohan, involves that, I've had a kind of newfound level of respect for the services you provide. So thank you.
Thank you. Looks like we have Andy Corin back. Does he need to press *6, Sarah?
Your question, that would help me.
Okay. Sarah, you're muted.
Sarah?
Your question.
We can hear, Dr. Corin, we can hear you now. I'm going to have Matt repeat the question.
Great.
Dr. Corin, I'll make this quick, sir. Why did you take this gig? Why are you excited to don the mantle of being our public health officer? I'm just, you know, it's such a shift, I'm sure, and being that it's not necessarily your level of expertise, can you just give the public a sense of what makes you want to take on this challenge?
I will. This was not, you know, this was not an easy decision to make. It is not, you know, my primary skill set. I think I'm gonna get out of the computer here because it's giving me feedback. So I have been practicing family medicine for a long time and have done some research in environmental health years ago in Chicago, and then research also in maternal and child health years ago in Chicago. And most of my recent work has been plain old family practice. In the recent 4 years, Dr. Doohan and I worked on establishing the first Mendocino County Family Practice Residency Program, which I'm happy to say has gotten off the ground, and we now have 16 new doctors. 12 of them are in training. They're full-fledged medical doctors, but they need their basically residency apprenticeship to become full-fledged family practice doctors. And that was a great accomplishment for us. And it gave me a chance to get away from clinical medicine. And when I was asked if I would like to be the Mendocino public health officer, you know, at first I retracted for all the reasons you mentioned, and it is out of my bailiwick. I've gotten a lot of encouragement. And the thing that has motivated me throughout my medical career has been to help the people around me. It has really been community service. So somebody local stepping up seemed to be the demand. I do have a skill set that is consistent with learning public health. Many family practitioners bridge over to public health, and that is, you know, that's what motivated me. I'm a little tremulous about doing it, but I think, and everybody tells me, I will learn it. And like I said before, my main intent is to bring the community together, the businesses, the religious groups, the schools, so that we're all in communication. It's open, above board. We're going to get through this thing together. And that's what it really is going to take, because we don't have high tech to rely on right now. It's working with people and people working with each other, being creative, innovative. How are we going to do what we need to do with this virus spreading around our community? Did that answer your question? I hope that answered your question.
Absolutely, Doc. It's great to make your acquaintance, and I'll be seeing you in future updates. Thank you.
Great. Thank you.
Adrian?
Hey, Doctor. Nice to meet you.
Hi.
I want to ask you if there will be any substantial policy differences between you and the current policies of Dr. Doohan, and both in specific policy points and in general approach. And I also want to ask, as part of that, what your policy will be regarding businesses like grocery stores and the like that have outbreaks, and will you mandate that they announce them? Under what kinds of timeline? Will the county be announcing that? And sort of what's the threshold for a business where you need to announce that? I think a lot of people want to know if a grocery store has people working there with COVID, but that might not be as applicable to a yarn store. So any thoughts on that? Thank you.
It's a great question. I would say this, that Dr. Doohan and myself agree, along with all of you, we want to save as many lives as possible in Mendocino County. And in order to do that, we need the science. We need advice from people outside the county as well as people inside the county. The experts around the state and other local health departments have been great so far. And I'm going to brush up and find out what they know and be in contact with them. Here in the county, though, we need to get our business people together so they figure out how to work with this virus in town. And our schools need to figure out how we're going to teach and care for our children without spreading illness around to them or the people in their families or their extended families and so forth. And that's my intent. So that's my policy guidance. And what comes down, I don't think is going to be that much different from what Mimi has said. As she steps aside, and that'll be a month, then we'll see how things go. But right now, I think we're on a great track. We've been keeping the numbers to a minimum, and it's thankfully to Dr. Doohan's guidance.
And the second part of that question about the businesses and announcements?
I want to be as open and educational to the entire community as possible. I think that's really important. And yeah, I'm going to switch over to, because my battery is getting low, to the speaker here. Okay. So can you hear me now still?
Yes.
Okay, good. So yes, I think that the businesses need to know. I think the questions that are being asked today are great, and they show us where we can probably do some better. But everybody from the businesses and the business leaders to the schools and the families and their children need to be in the loop. And so education, so community education and communication is going to be very important. And we'll work very much on making those things right. And if you have suggestions or you can participate, I'm open. We all are.
Thank you very much.
Jackie?
Thank you.
Hola, doctor Curran. Le saluda Jacqueline Orozco. ¿Tiene contemplado algún plan para mantener informado a la gente que solamente habla en español en la comunidad en de Mendocino?
Sí, la plan va a ser más educación, más información desde el departamento en español, con pintura si necesita, con personas entrando a la comunidad para educar. Mi español es así, no es perfecto, pero voy a tratar. Pero este es muy importante. Por seguro, la comunidad hispánica es sufriendo lo más ahora de este problema. Las infecciones, pero también el problema con los comercios cerrando, los problemas con esta población dando los servicios de los restaurantes, de los hospitales, de los centrales, los skilled nursing facilities. Todas estas personas son la mayoría de los empleados y son los más vulnerables. Y estos necesitan necesitamos proteger. Y ellos necesitan proteger a su mismo, la comunidad. Pero necesitamos en el Departamento de Salud Pública, nosotros necesitamos entender los problemas de la comunidad y no vamos a entender estas cosas sin personas como usted y otros que están los líderes en la comunidad. Perdón de mi español. ¿Puede entenderme?
Sí, sí, entendimos. Y aquí también tenemos a George que nos está traduciendo si es que se le dificulta el español.
Gracias.
Mike? And you're muted, Mike.
I do not have a question for Dr. Corn because Adrian asked my question. But I do have one question for Dr. Doohan, if I may ask it.
Yeah.
Okay, this is for Dr. Doohan. Dr. Doohan, now that you are going to eventually be leaving the position of public health officer, what are you going to be doing?
Oh my goodness. You really want to know?
See?
Well, I will
If
share
you
with all of
actually know.
you that I am doing two jobs. I am serving as your health officer, which I do on Fridays all weekend, starting at 6 in the morning and starting again at 6 at night. But during the daytime, I have a full-time job. I'm one of the assistant directors of the family medicine residency program at Scripps Mercy Hospital in Chula Vista, where I'm also based in the San Ysidro FQHC. I'm a teaching doctor, teaching family doctor. So I'm on the front lines of COVID in Southern California on the border. And I'm seeing the reality of what happens when COVID becomes much more advanced in the hospital and in the clinica there. So that's what I'm doing when I'm not with you. I'm really working two jobs simultaneously. But Fridays, the reason we have all transparency, the reason why Fridays are media days is that I am free from this other job all day on Fridays, except when I'm working in the hospital, which is once every about 5 weeks. I'm on for a week at a time, 24/7. So I have the frontline experience of COVID from the hospital wards and from the clinics, and Mendocino is my home. So I save up all my time to come back home to Mendocino because I love Mendocino. You're my people. And when I go to sleep at night and wake up in the morning, I'm thinking of you. I know there's been some accusations that I'm just dialing it in. I don't know what's going on, but I'm still very, very much connected with on the state level and the regional level, what's happening. And I'm also seeing it on the front line. So I am very concerned about Mendocino County, but I know we have so many strengths and so much resilience And I'm so proud, for example, of what we've done just in 1 week's time with the Latinx leaders coming together, including Jackie and George, and how we are responding to the need there in our community. It's just yet another example of how wonderful Mendocino County is. So that's what I'm doing. That's the truth.
Well, thank you very much.
All right. Well, thank you guys for joining us today, and we'll have more information soon about our schedule for next Friday. And I hope you guys have a great rest of the day, and we'll see you next week.
Thank you. It's nice to meet you all.